And the new tonight, a once anticipated acceleration in the vaccination process in the state came to a screeching halt when former Health and Human Services Secretary Alex Azar claimed a once promised national COVID vaccine stockpile no longer existed. 5 News reporter Juliana Clipson shows us how the lack of reserve shots Arkansas's vaccine allotment.
I think everybody feels like we're shorting them on the vaccine right now because we just don't have enough.
Waiting lists at community pharmacies across the state grow longer and longer, and the demand for the COVID-19 vaccine far exceeds the average 500 doses sent to each of Arkansas's 75 counties weekly.
One of the hard things right now is that the number of doses that the vaccinators are requesting are many times more than what we're actually receiving.
Pharmacies statewide anticipated their supply to grow when the National Reserve of Vaccines was to be released to the states, only to later learn the promised doses don't exist.
There was a belief that was communicated to the American public that they were holding 55% of the vaccine allotment in storage, and that they were going to release that vaccine allotment that they were holding in reserve to the states, and we believe that that was going to double the amount of vaccine coming into our state and all states.
Arkansas Pharmacists Association CEO John Vinson says the broken promise would have taken the state's weekly allotment from 37,000 to 75,000. Now that that's not the case, the slow rollout continues.
Just from a pure numbers perspective, instead of taking maybe 8 or 10 weeks to vaccinate this group, we could have done that in 4 to 5 weeks.
With the number of people on waiting lists across the state in the thousands, Dr. Dillahay with the ADH urges Arkansans to get on their community pharmacy's list and not multiple to complicate the system. Dillahay says it might be March by the time the state gets through Phase 1B. Covering news where you live, Juliana Clipson, 5 News.
Dr. Dillahay and Vinson both say they believe with a third vaccine prospect close to approval, that vaccine rollout could ramp up in the future. But for now, both say patience is key.